Welcome again to this evening lecture program for DNB students and postgraduate students in orthopedics through the Orthopedic Research and Education Foundation. And today we are privileged to have Professor D.K. Taneja from Indore, who's really a stalwart in teaching postgraduates, who's going to talk about sterilization and infection control, which is again a very important part of the oral examinations for your postgraduate qualification. So over to you, Professor Taneja.
Thank you, John. And the subject that we have chosen, slide share.
Share the screen.
Yeah, share the screen. Share.
इसलिए मैं पहले बंद नहीं करने
ये वाला हाँ इसको फुल पे आ जाओ
full screen, put it on full screen.
Okay. Yeah, okay. So where I thank John, the chairman of the Orthopaedic Foundation of India, which is our body which we have been taking care of the postgraduate training in this country. And today we have chosen a subject which is sterilization and infection control. You might ask, sir, why this very basic subject? Well, you know that in the practice of orthopedic surgeon, the biggest complication he is dreaded is that his patient gets an infection. Now, this infection will be there if there are microorganisms, and if you cannot control the microorganism, you will land up into a problem. Therefore, we must know how to control these microorganisms and how to have our infection rate, or what we call a surgical site infection rate, as per the international standard. That is what the whole objective of this lecture is. Now, what are we going to talk to you? We'll define certain very common subjects which you all know, that the history of infection control is extremely important. What are the types by which you can control these microorganisms? How do they act, and what is our conclusion, and what is our carry home message? Now, you know that we all have been talking about these words: sterilization, disinfection, antiseptic, sanitization, and antibiotic. Very basic subject. But let us revise what they exactly mean. Now, sterilization is a process which kills all microbes, including the spores. That is what the sterilization is. Disinfection is a process which removes and reduces the microbial count on a non-living object, not on a living object, where you do the disinfection of your house. Antiseptic is a process which removes and reduces the microbial count and prevents contamination in or on the living body. So when you are using this thing on a living body, sanitization is removing microbes from a public places. So these days, COVID-19, and we are doing sanitation all over the building, all over the mall, all over the picture hall. And of course, the antibiotics, you know, it kills bacteria inside the body. So please don't make any confusion between the sterilization, disinfection, antiseptic. They're all different things. Now, when you talk of an infection, overall infection, these three names cannot be escaped: Posture, Robert Koch, and Joseph Lister. We'll talk about this thing. Let me take you to a little bit very interesting part of the history of control of infection. Well, you know, way back in about 300 BC, the Hippocrates also recognized the infection, problem of infection. And many people talked about, they didn't know what actually was happening. And Galen talked it, whatever the things was coming, yellow thing, he would call it a laudable pus. And in 1750, Pringley published 3 papers and introduced the word antiseptic. Very few of us will know it, that this name was introduced way back almost 200, 300 years back. And in 1807, the first proof on the role of microorganism by Benedict Prevost, Isaac Bonnevitt, He talked about it way back 1807. So that is almost more than 200 years back. And people talked about that hand washing is very important. There are two persons who can be given credit to this thing. One is Oliver Wendell Holmes, and then other. Now, this Florence Nightingale, she was a lady about whom you know everything, and she would say the first requirement of the hospital is that it should do no harm to a sick person who has been admitted here. These days, we all know that you go to the hospital and you can come out with a strong nosocomial infection. So in 1860, the T. Spencer Wells emphasized the use of the fresh towels, rinsing of the hand, and he said we should not have any spectators in the OT. So this is a photograph, and I remember when I was a student, we also had the same type of operation theater where we'll sit down on the stairs to watch the operation going on. And this was, and man, if you open up the book of microbiology, Semmelweis from Vienna, who has been given this credit of that hand washing is extremely important when you touch a patient. So the Louis Pasteur and the Robert Koch both proposed the and in 1865, the Joseph Lister, who talked about the asepsis, about which we talk about it. And in 1879, a French microbiologist, Charles Chamberlain, was the first person who talked about the autoclave system, that is by sterilization using the steam. And another doctor also he took a credit for this thing, and he said that in 1886, Bergman, he said, we should be using the dressing of the autoclave this thing. Then we have been using the gloves. Now, this is a very interesting story. The William Halsted, who was a very celebrated surgeon in America, and his wife was an OT nurse, and they were just cleaning their hand with the carbonic acid and were doing the surgery. His wife, who was a nurse, said that, well, darling, I am getting a lot of dermatitis in my hands. I cannot scrub up by using carbonic acid. Can you? William Halsted had a very good friend in a Goodyear company who was making the tires for the car. And he said, can you do something to protect the hands of my wife? So the Goodyear produced the gloves. And since then, the gloves have been used by all the surgeons and OT staff since 1910. So how do these, whenever the process that we do of sterilization, you know, these the bacteria, and when they, whatever the method we use, there are 3 or 4 methods by which you can damage this bacteria. Their protein denaturation can take place, their membrane can get disrupted, or their nucleic acid can get damaged, or there's inhibition of the metabolism. So by using any of these methods or the combination of these methods, will destroy the microorganism from the body and will make them inactive, and therefore you will be free of these microbes. Now you see there are many types of sterilization which we must try to understand, which is we all know about it, it is just a revision. One is some physical agents. And what are those physical agents? Heat, radiation, ultrasonic, sunlight, these are some physical agents. In heat, we have a dry heat and a moist heat. And in radiation, we have got we all know that we have been using the ultraviolet rays in our operation theater. It is a broad spectrum bactericidal, this thing, but you have to take a lot of precaution with that, we'll tell you. And the other thing is that you all know that most of the things are getting gamma radiated, which is using a cobalt 60 as an agent, and because it has got a much better penetration into the tissue and thereby sterilizing this thing. Now, we in the operation theaters, we are using the filtration. Now, what is this filtration? Is basically that you try to filter the organisms which are in the environment. So we all know the lamellar airflow system, as you can see here. This is the lamellar airflow system, and these are the HEPA filters, and which is a high efficiency particulate air. And now we have a new thing which is called as the ULPA, which is called as ultra light particulate air filter. Now, in a HEPA filter, you have almost 99.7% efficiency, and but with ULPA, they say it is at 100%, and no bacteria or viruses can pass through that. So this is a very good breakthrough, this thing, and thereby you could have a very clean air in the operation theater. And then we have different types of the chemicals which we have been testing. Now let us talk about the dry heat. We all know that this is what you are seeing is a Bunsen burner. Now, if you remember that our classes in the physiology and microbiology and pathology, we used to have this Bunsen burner where you can have a loop or something and you can heat it up, make it red, and you can start using it. And that is why you can, that is scalpel or anything you want to heat it and make it sterilized. But there the temperature is almost to 160 degrees and 1 hour if you are using any oven where you can use a dry heat. So either you can use a Bunsen burner or you use an oven, and for that your temperature must go to 160 degrees and it must be for 1 hour that you can get a good sterilization. The most important is the moist heat. Now we all have been, when I remember when the student days and then we were young orthopedic surgeons, lots of things were being boiled and given to us. An instrument, they will put into the boiling water, give it to us, and it causes the denaturing of the protein because of the heat. And that is what being used very extensively. Now, of course, we are not using it. The biggest drawback of using a boiling water was that it would not kill any spores. And that was a big drawback. Therefore, there is a process called as a tyndallization. Then I didn't know what tyndallization was when I was reading a book of microbiology. Then there was a gentleman called as John Tyndall. He said that by boiling also you can kill the spores. How do you do that? Boil it, cool it, put it into an incubating period for some time, and repeat this thing 3 times. Your spores will be killed. So it was a very tedious process. So it almost lost its popularity. And we all know that what Louis Pasteur talked about, that if you have a liquid and you heat it up to 71 degrees centigrade for 15 to 20 seconds, so you will be able to reduce the microbes in that liquid. That is how the milk was heated and then cooled down, and that is called as a pasteurized milk, what you are doing it. The most common and the most important thing is autoclaving, on which the students are normally asked this question. Now, what is a autoclaving? We have told you that the people who popularized this autoclaving system. Now, it is a tough double-walled chamber, and in that there is air. That air is removed, and then a pure steam. There is a water which is heated up. That water gives a steam, and that steam, when there is a pressure, that it raises the temperature to 150 degrees, and therefore under pressure of 12 pounds, and for 15 to 20 minutes, it will kill all the spores. That is the fundamental things of doing autoclaving of the instruments and the linen. And you see, this is sometimes very commonly question asked: how much pressure, how much time you will give it. Now, if your pressure is 15, temperature will be 121 degrees, you take 15 minutes. If your pressure goes high, 20, temperature will go to 126, your time of sterilization will come down by 5 minutes, it is 10 minutes. If it is again pressure 20 and you raise the temperature to 134, within 3 minutes you can get in an autoclave and your spores can get killed, and this is called as a flash autoclaving. So you can sometimes your instrument has fallen down, important instrument, you tell your OT nurse, I want this instrument immediately. So they can, within 3 minutes, they can autoclave it and give it back to you. So we'll see that it is a very dependable, it is a non-toxic, it is inexpensive, it is a bactericidal, sporicidal, and it penetrates into any type of fabric. So what is important is that you must do the monitoring very properly, that your autoclave is being done very accurately. You have to do the recording of the temperature, which is that should give you accurate temperature. Number 2, we put that chemical color bars, which under certain Once the things get sterilized, it will change the color. You must see that thing. And sometimes you can take a culture from the things which are getting autoclaved and send it back to the microbiology department and find it out whether they are growing any spores or any organism. That's a very foolproof method, and it must be done once in a month or once in 2 months' time to get a biological check on your autoclave system. Now we must understand that you see there are prions, spores, mycobacteria, non-enveloped viruses, fungi, vegetative bacteria, and enveloped viruses. So the prions and spores are the most difficult to kill them. It's very, very difficult to kill them. And the enveloped viruses and vegetable bacteria are very easy to do this thing. So it must be in your knowledge that what is important, what is not. So spalting classification is this, that if you have a very low level of disinfection, it is those patients which is non-critical. But if you have some group of the patient which is semi-critical, you can have the high level of disinfection. And of course, the best is where you cannot take any chances is to do a proper sterilization of the instruments and your linen. Now, one of the important thing is that you see you have been using your theater again and again and again. So you must do a fumigation. Now, this fumigation can be done these days. We have got a fogging machine. You can see this type of two fogging machine. You can use a electric boiler method in which you can connect it to a water which is being which is heated up and the steam is coming up. You can put that steam into whole of the operation theater, and you can use a potassium permanganate in the machine, and which will do the fumigation. Now, the most important, this is what we have been telling about the ultraviolet rays, that you have to put the switch should be outside, there should be a warding there, that don't go and expose yourself to ultraviolet light, which is you have to put it on at night and switch it on in the morning. You must put on the UV rays protection like goggles, caps and gowns and gloves, and then you go to the operation theater. That's very important. Now this is a potassium permanganate. So you have the crystal, about 150 gram, and 300 ml of formalin added to the every 1000 cubic feet of OT, which is then sealed, and the fumes are left overnight. The whole of your operation theater will get properly fumigated. This is a very, very important step, and for that you should always check from your OT supervisor whether this thing is being done properly or not. Then we also have got this, the other type of these solutions has come, like D125. And if you ask me frankly, I didn't know what D125 was. Then I looked into the literature and found it out. It is a third generation ammonium compound. So this is now they are using it and mixing it with the 1 liter of tap water for 1000 cubic feet of the area to be covered. And in the OT, in the ICU, cath lab, these days they are using the fogger machine for getting a proper sterilization and the fumigation of these areas. Very important. Then coming to the different types of the chemicals which are coming, and the ethylene oxide is now being very extensively used, and you can see that this is a small machine, ethylene oxide, and this ethylene oxide is a very highly inflammable. So this is mixed with other gases, so the inflammability is reduced. So all sharp instruments, rubber, silicone, etc., your arthroscopy, endoscopy, laparoscopy instrument, all these things can be very well sterilized in your ethylene this thing. Here, once your main switch is on and load is ready, you put everything into the machine, close the door, and raise the temperature to about 60 degrees and allow the gas to go in and leave it for 10 to 12 hours. Everything will be beautifully sterilized. Very cost effective, very nice method. And our OT supervisor who is with me, you can ask him any number of questions on this thing, and he'll tell you that how exactly they are using it. Now we all have been seeing this glutaraldehyde chemical, which is aldehyde group of chemical. and which is marketed in the market by Cydex, by the Johnson & Johnson company. And this is mixed with an activator, and then it is put into a Cydex tray like this thing, and you can put your instrument into this thing for sterilization. But if you want to put it, you want your spores to be killed, then you have to leave it for a very longer time, and maybe it's good to leave it for overnight before you can get a satisfactory result out of this thing. The other thing is this is what we call as a formalin chamber. So you have about 8 tablets of formalin, which is put inside this chamber. You can put the rubber instrument, the other sharp instrument, or any other instrument that you want to sterilize it. Leave it for about 8 hours, and then you can remove this thing because it has got a very pungent smell. The one thing that we do not know, and which I want to emphasize, that this formalin is in a carcinogenic. And when I was reading this about the formalin, they said the maximum exposure time to any person working in the OT is 8 hours. Beyond that, you are likely to get the cancer, so you should be very careful. And this is what I was telling you, that it is a carcinogenic. Maximum time of exposure permitted is 8 hours, and this formaldehyde, formalin 37% by weight, it inactivates the viruses and all type of toxins. This is very commonly used. Now we go on to the disinfectants. There are many disinfectants, and it is directly proportionate to the temperature, the concentration that you're using, and how much time you will take it. The most commonly used disinfectant these days in COVID-19 is sodium hypochlorite. This is become a household name. Every house is keeping a sodium hypochlorite, and they have got a pump which costs about 250 rupees, and everybody 0.5 to 1% solution, and you can spray it in your house, and your clinic, everything can get sanitized. Although microbiologists will not agree, and they say the sodium hypochlorite should not be used in the houses for the disinfection, because the best thing is to use a detergent, soap solution for cleaning your walls and cleaning your house. Now the carbolic acid, for which the Joseph Lister became so famous, and he used to do the carbolization, and he published his work in 1867 in Lancet, and it became the first step in the development of asepsis in surgery. On 12th August 1865, carbolic acid was used for the first time in an 11-year-old child who had a compound fracture of tibia and fracture, and which went on to heal. And that is how the carbolic acid became so very popular that everybody started using the carbolic spray. They started using the carbolic acid for cleaning the everything in the operation theater, the table, the trolley, the lights, and boiling boil operators. Everything started using. Now they are using probably Lysol also they are using. And there are many, in this list, there are many chemicals like hexachlorophene, trifluosan, chlorhexidine. We all know that the chlorhexidine is used very extensively for scrub of the hand. Now, out of the chlorhexidine and betadine hand scrub, they say chlorhexidine is better than the betadine scrub because they reduces the count or bacterial count on your hand much more than the betadine scrub. And we all know we have been using iodine, but the betadine is nothing but the iodine, but mixed with the iodophore, and which is less irritating. And we, of course, you know that how the chlorine is used for the cleaning the water, etc. Then you have chloramine, selenium, which is an antifungal. And of course, these days, the pharma company in COVID-19 time, they have made billions and billions of rupees by selling the alcohol, sanitization mixed with the water, and which has increases the penetration, and it is a bactericidal, fungicidal, but it is not good for the spores and the viruses. So, but the only disadvantage is that if you are using too much of alcohol on your skin every day, 3-4 times a day, your skin becomes very dry and may develop a type of a dermatitis. So these days for sanitization of your hand, or disinfection of your hand, they have you come up with a new type of a herbal sanitizer, which are far better than this thing. But I still talk to the microbiologists. They say, sir, nothing better than washing your hands again and again. So that's what is going on. Then we know certain heavy metals, like people were using silver nitrate, especially in the children, newborn children, who will likely to develop a eye infection through mother vagina, gonorrheal infection. So they were putting those drops in the children. And sulfur diazine, we have been using it for wound healing. Mercury chloride and mercurochrome, I have been using quite a bit, and it's very good in pseudomonas infection. You can use that, and of course we know when there's a good granulation tissue, you want to cauterize sort of a thing, you can use a copper sulfate and zinc chloride. These are some heavy metals you can use it. Now this is the different types of the method that we have been using it for sterilizing the whole our operation theater and things going from the central sterilization room to the different wards and ICU and NICU and the other places. Uh, Now, once the instruments come back, the most important is that how do you clean these instruments? Because unless until you have a good cleaning, you cannot talk of disinfection. And once you have done cleaning, then talk of disinfection, then you talk of sterilization. If you go straight forward to the sterilization, it is going to be very defective. So you can just clean the instrument by just water and brush, or the better method is to do an ultrasonic cleaning. So ultrasonic cleaning can be done manually. So you have a pre-cleaning chamber. In this chamber, all instruments are primarily cleaned with plain water to remove any visible particle. So just put plain water, it will get clean. Disinfected chamber, second chamber. In this chamber, the soiled instruments are decontaminated with the help of Corsolex plus solution and water. Then you have got an ultrasonic chamber. In this chamber, the instruments are cleaned with the help of a multi-enzyme cleaning solution in 2% strength. Then you have a rinsing chamber. In a chamber, instruments are rinsed with plain water. And then you have got a drying chamber. In this chamber, all the clean items are dried with the help of dryer at a temperature of almost 60 degrees centigrade for 15 minutes. Now your instruments are ready. Now you can plan to do it, go for autoclave or sterilization, whatever you are planning to do. Therefore, in conclusion, I would say that as a postgraduate student, you must know which item to be sterilized where. Now, one of the, we talked about the dry heat, which you get it in a oven at a temperature of 160 degrees. You can put any metallic thing, you can put glassware, any type of ointments, oil, wax, any type of powder, or even the sharp instrument, which will not get spoiled. So these all things can be used, sterilized by using a dry heat. Then you have a certain thing which are heat labile substances like sera and antibiotic. You use a filtration system where you have passed it through that air, which are almost microorganism free. Now the OT and the different type of laboratory have to be sterilized, and for that the ultraviolet rays are the best thing, and you have to take the precaution which has already been told to you. Don't be negligent that you go into the operation theater when the ultraviolet lights are on. It can cause a lot of damage to your eyes. Then you have got, we all know that plastic syringes, gloves, petri dishes, our implants, needles and sutures, they are all come through a gamma radiation. The gamma radiation means that you have a very high penetrating these rays, which are using a cobalt 60, which will kill all the organisms, including their spores. So that is a very big, therefore all implants, total joint replacement and everything comes gamma radiated. Now plastic material and the lensed instruments like endoscopic, etc., are best sterilized by the ETO, and they can also be put into a the formaldehyde, formalin chambers, but the best thing will be to put them into ETO, and your lens and everything will not get foggy. Then you have got blunt instruments and linen, which is the main bulk of the whole operation theater. They're all blunt instrument and linen. Your blood, your towels, your everything, drapes, and everything that you use have to be autoclave. And the best is that autoclave machine, which are both vertical and horizontal and of a different capacity they are available. But the most important thing is the one who is operating the autoclave, he should be very, very careful about what is the temperature going on, what is the pressure, and what is the time. And after the cooling, when everything dry up, you take it out and make sure that the color coding bars have changed their color, then only you should use those autoclave this thing. So the my clear-cut message is that the first and the foremost fundamental thing is that you have to do the cleaning first, do a disinfection, do a sterilization, because this is the backbone of the infection prevention and the control of the infection. You all know that if you talk of the international standard of the surgical site infection, below 1% is the international standard, which is very difficult to get it. 0% nobody can get it. Even less than 1% is very difficult. Between 1 to 2%, well, it is acceptable all over the world. If your infection rate goes above 3%, it is a very serious matter of concern. And this all you can prevent it by strict OT discipline and keeping an eye what is going on in your operation theater. Thank you very much for your attention, please. Thank you.
Thank you, Dr. Professor Taneja.
Yeah.
So questions?
Any question?
Yes, sir. So, Amit has one question, sir. Difference between gas plasma and gas irradiation.
Gas plasma?
Yeah, and gas irradiation. You want to know the difference?
No, I don't know what is gas plasma, but what I know the gas irradiation is what is the gamma radiation. Is that right? Is there anything gas plasma like? Gas plasma? No, I don't know if anybody knows what is a gas plasma. What we know is the ionized radiation. Okay. If anybody knows about the gas plasma, I have no idea. And if you know, Janki? No.
Gas plasma, I have no.
I've also not heard. I'm hearing it for the first time. Maybe if somebody knows it, can answer it. Yeah.
Okay, sir. We'll check that one. And
well, I know that there's something called plasma sterilizers, which I think is just a different form in which the gas is.
I think so. After plasma, what is a plasma? Plasma is a media.
Yeah,
it is
right.
When
it's
you
just
talk
a different
about
way
plasma physics, plasma physics is just in an environment. It is in a media by which
transmitted
the gas
through
will
the
pass.
thing. Yeah.
Through which the gas must be passing. That's what I think. So.
Okay, sir. One more person want to ask something. What is the question? You please ask.
Okay. Hello. Is it me?
Yeah,
okay.
Yeah.
I raised a hand for the gas plasma sterilization query actually.
Yeah.
Yeah, please, if you know the answer, would you please tell us? That will be good for all of us.
So thank you very much, sir. I am Amrita Jasani, working in Arihant Hospital itself.
Oh, you are the consultant microbiologist. Please, Amrita, answer my question. Yeah, good. Yes, Amrita.
Thank you. So actually, I'm not much aware about this, but this plasma sterilization is based on the principle of oxidation. Because the live cells, we are very well aware that we do oxidation, and like in general, I want to say catabolic reactions are going on. So oxidation is one method by which we can kill the organisms. So here we are using plasma for doing this oxidation reaction. So some chemical reaction goes on medium, It kills, it deactivates the bacterial cells involved in the mixture. So you get the
I think so. They use hydrogen peroxide, and I think, but it's a low heat sterilization process with the
John,
gases.
the hydrogen peroxide, which is used in about 6% concentration, it gives lots of nascent oxygen. And that nascent oxygen, when it goes deep into the tissue, it is very good to kill the anaerobes because bacteria. So that is how the hydrogen peroxide can be very useful. Yeah.
Exactly, sir.
Amrita, anything on this thing on hydrogen peroxide?
So you have covered it, sir.
It's used. The hydrogen peroxide is used for plasma sterilization. So they have these special machines, boxes, where you put them in.
Yes.
No, वो दूसरा fumigation with hydrogen peroxide is also done.
Yeah. That is what my OT supervisor
Sterilization
is saying.
so that's done for fumigation also instead of formaldehyde.
Yes.
Less toxic, but this is also used for plasma sterilization of instruments at a low heat. So instruments you don't want to put through high temperatures for autoclaving, you can use in this.
Amrita, can I ask you one question? Amrita, for the anaerobes, do you take any other special precaution in the sterilization, or this autoclaving and the ATO will all kill the spores of anaerobes also?
So they take care of these anaerobes as well, sir. There's no need going unnecessary. So, the one thing I would like to add, like in ETO, as you have mentioned it earlier, cleaning is a must before sterilization. I would like to add there are certain instruments which have tubings in it. So it's very difficult to sterilize those kind of equipments. So first, if we do a thorough cleaning, then only we will get rid of these biomolecules from those equipments. So it will be helpful in sterilization, because in infections, in ortho-related surgeries, I have seen many patients with biofilms there. So these organisms get, they captivated in the tubings itself, and then they pass on to the surgeries, and then they infect the wound, and there also they form the same biofilm. And in SSIs that I have reported earlier, I have found these as a root cause of the infection, sir.
So this is a problem in tubing, all cannulated instruments, etc. So you need to clean the inside with special methods to make sure that it's adequately clean, because just washing the outside is not adequate.
I will ask Ram Bhrose, who is our chief OT supervisor, how do you clean the cannulated instruments?
सर एयर गन से क्लीन करेंगे, और नहीं तो हम ट्रे के अंदर ये मल्टी एंजाइम जो होता है वो डाल के 1 लीटर पानी में 10 ml मल्टी एंजाइम केमिकल मिक्स करेंगे, और उसके बाद में उस कैनुलेटेड इंस्ट्रूमेंट को हम उसके अंदर डाल देंगे. जो भी फेट पार्टिकल या ब्लड पार्टिकल है वो उसमें से ऑटोमेटिकली रिमूव हो जाएगा, और फिर हम एयर गन से उसको क्लीन कर देंगे. मतलब हमें कोई प्रेशर नहीं देना होता.
John, what Mr. Ram Bhrose, who is doing this job every day, he said that we have the pressurized air gun by which we pass through the cannulated instrument, clean them, and then we have a special type of a tray where they have special types of solution and enzymes, and those instruments are put into that. Anything which is inside, they get absorbed. It gets absorbed. I will tell you.
Dissolve them and then you have to remove them with the gun.
Yeah, exactly. And then you can use the air gun, and then you can clean them.
But they need more care than with other instruments, because inside this cannulated portion you can have
I will tell you, John,
etc.
John, I will tell you one very small story with my experience. I had a gentleman, a superintendent engineer, in which had a fracture neck tumor. I did a cannulated screw. In the next day, the patient had a fulminating infection. I couldn't believe I was doing it in the best nursing home. I said, what has gone wrong? Why he got such a fulminating infection? I went and checked the instrument. And then I found that one surgeon has done the operation, same terminated screw, a few hours ago. And they gave me the same instrument by putting it early, autoclaving it. And when I checked it, they say those instruments all had the blood inside. They all had the blood. That was the big, I learned the lessons. Anytime I use now a cannulated any instrument drill or anything, I just try to see this, that's absolutely clear.
Yeah.
And our OT supervisor is a very experienced, 30 years experience in OT. Yeah.
Sure.
So, sir, you please stop the slides here, sir. Yes. Yes, sir. Please stop. Yeah.
Screen sharing बंद कर दीजिएगा.
अच्छा अच्छा, okay, thank you.
और if
ऊपर में होगा, ऊपर में.
हाँ, thank you, stop. Right.
Okay,
yes, sir. Sir, if anybody else have some question, please ask. Okay, sir. So, sir, we use some sterility indicator. So, what is that, sir? If it is asked.
You have all these paper strips now. They have different things. So you have one for
class 1 indicator होता है, एक class 2 indicator होता है, फिर class 5 होता है, और फिर biological indicator. ऐसे 4 indicator यूज करते हैं. Class 1 indicator हम पैक के ऊपर लगाते हैं.
ओके पेपर जो होता है ना,
हाँ बताइए.
क्लास 1 इंडिकेटर हम पैक के ऊपर के लेवल पे लगाते हैं, जिससे हमें डेट और मैन्युफैक्चरिंग डेट और उसका सब कुछ पता रहता है. क्लास 2 इंडिकेटर हम ट्रे के अंदर डालते हैं, जिससे ये पता चलता है कि अंदर तक स्टरलाइजेशन प्रॉपर हुआ है या नहीं, है ना. और क्लास 5 जो इंडिकेटर है वो भी ट्रे के अंदर ही जाता है. उसमें एक टिप बना होता है बटन जैसा. जब वो स्टीम स्टरलाइजेशन से वो पेनिट्रेट होता है तो वो कलर कोड की एक लाइन बताता है कि आपका स्टरलाइजेशन परफेक्ट है. और क्लास 2 जो इंडिकेटर है वो हमारी मशीन चेक करने के लिए होता है, उसको बोवीडेक बोलते हैं. हम उसको एम्प्टी मशीन के अंदर डालते हैं, जिससे हमारा टेम्परेचर, हमारी मशीन का कोई लीक, वो टेस्ट होता है. उसमें भी कलर चेंज होता है. और जो बायोलॉजिकल इंडिकेटर होता है उसको हम ट्रे के अंदर ही डालते हैं और एक पर्टिकुलर टेम्परेचर और टाइम और पीएसआई के अकॉर्डिंग हम उसे निकालते हैं. तो उसमें जो स्पोर्स बैक्टीरिया होते हैं एम्पुल के अंदर वो किल्ड होना चाहिए. तो हम एक उसके साथ काउंटर बायोलॉजिकल इंडिकेटर भेजते हैं और एक जिसमें बैक्टीरिया है वो भी भेजते हैं, और जो हमने किल्ड करे वो भी भेजते हैं, जिससे ये पता चलता है कि उसमें जो बैक्टीरिया थे वो किल्ड हुए या नहीं हुए. काउंटर इसलिए साथ में जाता है.
So basically, you should have 3 of these things in every sterilization thing. The one is something like OK paper, which is on top of the packaging, which also changes color, which has the date and time of the sterilization also written on it. Then inside you have one which tells you that there's been enough adequate sterilization. And the third is the biological one, which will show you that spores, that the sterilization has been adequate to kill spores, etc., which are the anaerobic stuff. So these 3 are the bare thing minimum that you should have in your.
That is a very, very important thing. Very, very important.
And about the cold sterilization, sir, what the student should know for the exam?
About what they must know.
Cold sterilization, yes, sir.
Cold sterilization.
Cold
sterilization.
Cold sterilization तो सर ऐसा कुछ अलग से
without heat से cold. He's talking about cold.
Chemical sterilization ये जो cold sterilization
all chemical.
So basically, where you don't use heat, is ETO2.
Sidex
not using heat.
ETO and all are cold sterilization. No?
ETO में तो फिर भी
60 degree temperature रहेगा.
60, but it's not
cold
like
sterilization. Chemical sterilization.
No, but also the gas plasma one is cold sterilization.
Amrita. Anyway, our microbiologist is here. I don't know.
The gas plasma is also cold sterilization.
Okay. Right.
So anything what is not steam or like hot air over
heat or very high temperature, they will come under the
100% sure. Cold sterilization is chemical sterilization.
chemicals.
100% sure.
Hello.
आप साइड इफेक्ट से
Yes,
अभी
madam. Yeah.
Amrita, what
नहीं
is
नहीं,
a
वो तो
cold?
वो तो है ही, but you also have this gas plasma ones which are cold sterilization.
हाँ वही है.
Amrita, what is a cold sterilization?
Sir, as the Ram Bharose sir said, ki chemical
Okay.
sterilization only, sir.
Acha, it is a
Many heat.
chemical. Okay.
Yes, sir. So here, as in case of chemical sterilization, we are not using any type of heat for sterilization, sir. So any chemical sterilization, as said, it comes under the cold
Cold.
sterilization.
Okay, okay, right.
जो है हीट सेंसिटिविटी वाले जो इंस्ट्रूमेंट होते हैं जिन्हें हम गर्म नहीं कर सकते उसको हम केमिकल स्टेरिलाइजेशन करते हैं, उसी को ही हम कोल्ड स्टेरिलाइजेशन.
What Ram Rose is saying that there are certain instruments which cannot be, which will not tolerate the heat and they'll get spoiled. So they have to be sterilized by using a cold method, and the cold method is using different types of chemicals by which you can kill the spores and that kind of.
Sir, one more question regarding the Sidex, sir. Sometimes we use Sidex for in between the operation theater. It's a practical problem is there for 10 to 20 minutes. Few of the surgeon, they put the instrument. If it is getting infected or some during the operation, so is that okay, sir? If we can put it in between, or few of the people, yeah.
कि ऑपरेशन थिएटर में ऑपरेशन करते वक्त साइडेक्स में डाल के इंस्ट्रूमेंट को निकाल लेते हैं, वो ठीक है क्या? साइडेक्स में डालते हैं.
सर हमें कोई भी इंस्ट्रूमेंट अगर साइडेक्स में भी डालना है तो 15 मिनट तो रखना ही चाहिए. और 15 मिनट के अंदर हमारा फ्लश स्टेरिलाइजेशन में 3 मिनट के अंदर स्टेराइल हो रहा है इंस्ट्रूमेंट, तो हम साइडेक्स में डाल के अगर नहीं यूज करें तो ज्यादा अच्छा रहेगा. अगर ठोस मेटालिक इंस्ट्रूमेंट है जिसे हम स्टीम स्टेरिलाइजेशन कर सकते हैं तो उसे तो हमें 15 मिनट के अंदर हम स्टेराइल कर सकते हैं. और अगर अपन कोई ऐसा इंस्ट्रूमेंट है जैसे इंडोस्कोप, लैप्रोस्कोप से रिलेटेड, तो उसे हम साइडेक्स में डाल के 15 मिनट बाद सलाइन से वॉश करके यूज कर सकते हैं.
Those are anyway done in Sidex.
Yeah,
Yes.
those are not put into the autoclave. Because anything which can be autoclaved, they can give you within 3 minutes time flash autoclaving. They can give it to you fully autoclaved instrument. An instrument which has fallen down. But some instrument which cannot be put into autoclave will have to be put into Sidex, wait for 15 minutes, treat it with saline and use it. And hope for the best. Yeah.
About the OT disinfection, sir, usually it should be done every evening, sir, for the next day, or
Fumigation every day.
What do you mean disinfection should be done after every?
अगर हम कोई इन्फेक्टेड केस या हमें कोई डाउटफुल केस है तो हमें एवरीडे करना चाहिए, नहीं तो हमें सप्ताह में एक बार भी सफिशिएंट है. कॉर्सोलेक्स प्लस रमन वेल का प्रोडक्ट है, उससे अगर हम वीक में एक बार फ्यूमिगेशन फॉगिंग मशीन के जरिए कर रहे हैं तो वो सफिशिएंट है सर. पर हमें जरा भी डाउट है कि कोई इन्फेक्टेड केस है या स्टोमालाइटिस कर दिया या कुछ हमने हेपेटाइटिस बी कर दिया, तो हम कॉर्सोलेक्स प्लस से फॉगिंग कर सकते हैं. फॉगिंग करने के 1 घंटे के अंदर हम ओटी ले सकते हैं. अगर हम HIV पॉजिटिव केस भी करते हैं और अगर हमने 1 घंटे पहले फॉगिंग करके और 1 घंटे बाद दूसरा सिंपल केस लिया तो भी सफिशिएंट है. हमारी ओटी 1 घंटे में प्रिपेयर हो जाती है अगर हम फॉगिंग मशीन का इस्तेमाल करके कॉर्सोलेक्स प्लस या अदर केमिकल कोई भी यूज करते हैं.
It is not irritating.
नो इरिटेटिंग, कोई इरिटेटिंग केमिकल नहीं है. जैसे 1,2,5-D बोला सर ने, वो भी कॉर्सोलेक्स प्लस है, कुछ भी नहीं है. अपन 1 घंटे के अंदर कितना भी हाईली इन्फेक्टेड केस करने के बाद फॉगिंग करके फ्यूमिगेशन करके 1 घंटे बाद ले सकते हैं केमिकल.
Yeah, so I think disinfection, surface disinfection, you should do after every case. Okay, all the tables, all the things should be wiped with disinfectant every case. Okay, fumigation is not done.
सर हमें वीकली कल्चर भी ओटी का लेना चाहिए. जिससे हमें आइडिया आता जाता है। हम मतलब हम
वो-
वीकली कल्चर करते हैं, हमारे यहाँ जो केमिकल हम यूज करते हैं उसका हर 15 डेज में कल्चर करते हैं। हम जो ऑटोक्लेविंग मशीन और ईटीओ मशीन यूज करते हैं उसके अंदर से भी स्वैब लेके उसका भी कल्चर हर 15 दिन में यूज करते हैं। उसके बाद में हम एयर कल्चर भी यूज करते हैं ओटी के अंदर। हर सप्ताह में एयर कल्चर मीडिया की डिस्क खुले वातावरण में रख के और उसे 1 घंटे बाद भेजते हैं। अगर हमारा फॉगिंग परफेक्ट है और हमारा हेपा फिल्टर परफेक्ट काम कर रहा है तो कोई दिक्कत नहीं आती, हम यूज कर सकते हैं।
राम भरोसे मुझे आपसे एक प्रश्न पूछना है। ये जो तुम्हारे हेपेटाइटिस बी के जो पेशेंट आते हैं उनके सर्जरी के लिए, उनके लिए क्या स्पेशल प्रिकॉशंस लेते हैं या उनके लिए इंस्ट्रूमेंट यूज होते हैं, उनके लिए कैसे?
वो जो भी हम हेपेटाइटिस या एचआईवी के लिए जो इंस्ट्रूमेंट यूज करते हैं उस इंस्ट्रूमेंट के हम एक तो लिमिटेड इंस्ट्रूमेंट यूज करते हैं, बल्क नहीं करते। जो हमारी जरूरत की चीजें हैं उसे इस्तेमाल करते हैं और उसके बाद उसे हम सिंपल पानी में धो करके फिर मल्टी एंजाइम में डाल देते हैं, जिससे कैनुलेटेड या सिरेसिस में कोई भी ब्लड पार्टिकल या टिश्यू फंसा है वो रिमूव हो जाता है। फिर उसके बाद हम ये कॉर्सोलेक्स प्लस मल्टी यूटिलाइज एंजाइम है, मतलब केमिकल है। कॉर्सोलेक्स प्लस के केमिकल का घोल जो बनाते हैं उसमें आधा घंटा के लिए डीप करके छोड़ देंगे। फिर उसके बाद में हम उसको ड्राई करेंगे और वॉश करके फिर उसको पैक बना के फिर ऑटो करेंगे। ये इंस्ट्रूमेंट भी हम अगर चाहें तो 1 घंटे के अंदर हमारा पूरा प्रोसेस हो जाता है, ऑटोक्लेव होकर दूसरे केस के लिए रेडी हो जाता है।
The only thing I think is other thing is for disposables for the draping and gowning for these cases. So you don't use your you don't use the cloth drapes, etc.
Yeah, it has to be all disposable. Everything disposable. Yes.
लिनन तो सभी डिस्पोजेबल यूज होगा। लिनन गाउन जो भी है वो तो किट आपका डिस्पोजेबल यूज होगा। तो जो हमारे मतलब हैंड इंस्ट्रूमेंट है जो हम यूज करते हैं, नाइफ है, आर्टरी है, कॉकस है, नीडल होल्डर है, सीजर्स है, या हमारा कोई जर्नल इंस्ट्रूमेंट है, उनके लिए हम केमिकल यूज करते हैं और उसको बाकायदा आधा घंटा उसके कॉर्सोलेक्स प्लस में रखते हैं। जैसे आप साइडेक्स में रखते हैं ना सर, वैसा का वैसे ही सिस्टम कॉर्सोलेक्स प्लस में रख दो। फिर आप अपना ग्लव पहन के उसको सिंपल वाटर में धो के और ड्राई करके और पैक लगा दो और आप अपना रूटीन जो अपना मेथड है स्टीम स्टरलाइजेशन का उसमें डाल दो।
Okay, sir. So the fogging is
कहाँ से आ रहा है?
बाहर में कुछ है, I think from my
too much noise. Okay, so I think that should be enough for today. Thank you very much, Professor Taneja. That was excellent, and please convey our thanks to your colleagues who've helped and Mr. Ram Bharose. And so I think that brings the end to this particular webinar, and we'll see you again next week.
Thank you so much, sir.
I enjoyed giving this lecture. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you.